in other areas, would you have confidence in a leadership figure if their response to the crisis was what he's saying now? If you were riddled with cancer and your doctor said, just don't worry, at some point it's just going to just disappear, I hope. Or if I was leading you through the woods and we came across a black bear and I said, don't worry, it's just going to disappear someday, I hope. Would you have faith in me in any of those cases? What if it was the bear and the bear had killed 130,000 Americans over the past few months and I told you, don't worry about that bear, it's just going to go away at some point? Would you have faith in me? No, you would not. This is
No,
madness.
you wouldn't.
Madness.
It's John, madness, insanity. There's just a myriad of different words we could use to describe this. But at the running core of all this is also disappointment, fear, and frustration, because the American people, we want to get back to business as usual. And we know that business as usual will never be the same again. We will never emerge from this, the country, the society, the people we were prior to March 17th, or even March, when we were forced to go into hibernation, if you will. So,
to continue the bear metaphor,
right? It's but it's just it becomes a point of, like, you get tired of hearing the same thing over and over again. You get tired of being forced to listen to someone who just doesn't care. And you stop and you ask yourself, well, am I interpreting this right? Am I the crazy one? Mm-hmm. Am I seeing this differently? Or am I not present? Am I projecting something within myself that can't reconcile the stupidity that's coming out of the White House?
Yeah.
But that's just it, John. It's stupidity, and people are dying. We're losing lives. Corona is a thing still. Corona's not. It's not this imaginary thing that has got. I mean, mind you, it has gotten better. We have been able to get some kind of control, and that control is education. Us being taking autonomy over our health, making sure we're wearing the mask, making sure we're sanitizing, things of that nature. We've been able to take control that way, but it needs to be beyond that. Mm-hmm. And the White House has the resources to make sure that we are going beyond that. And that's just not what we're seeing. It's just not happening. It's not happening.
Yeah. And so, Trump's strategy is to just continue to deny it. But we're looking out there every day at the records being made, and it's scary. And so I just want to give a quick update on where we're at nationally. More than 48,000 coronavirus cases were announced across the country on Tuesday, the highest daily number since the outbreak began, with 8 states reporting single-day highs: Alaska, Arizona, California, Georgia, Idaho, Oklahoma, South Carolina, and Texas. And if that's scary, I said Tuesday. What about Wednesday? The record was beat once again with more than 50,000 cases in just a single day. And as you point out, things are getting better in terms of, the death numbers. I mean, they've sort of stabilized now, but they're lower than they were a month or 2 months ago. But the cases continue to go up. We just passed 50,000. Dr. Fauci in the last 24 hours said he wouldn't be surprised for us to hit 100,000. And that's verified, tested infections each day. We know that the actual numbers are far higher, because while we're now testing about 500,000 people each day, that still is a very small percentage of all the people that are likely to be infected with this. And so, yeah, the only hope at this point is that the death numbers do not rise the way that they almost certainly are going to, now that we're seeing increasing cases again.
I agree. And again, to just drive home the fact that we are now armed with the knowledge to protect ourselves. Because if you look back to March and April, when this was like, what is happening? It was beyond dire. Every press conference was New York City, 8,000 dead, 36,000 dead overseas. Luckily, we now know how to protect ourselves. But in that list of states, John, what is interesting is that some of those states have gone on record before saying, we're good. I'm not going to say which ones, but one of them is a major state in the union. And they were being very vocal about, well, we have it under control. We have minimal infections, and now they're on the list of having the most. So this virus doesn't know race, doesn't know sexual orientation, doesn't know creed. It doesn't care. It does not care. And us being naive and ignorant and becoming lax is only going to be to our detriment. So we have to continue wearing the mask. We have to continue the social distancing, and we have to take ownership of COVID-19 in the sense and in the frame of our health.
Yeah. I think I know what state you're talking about there. And by the way, I want to say, and I will say this on literally every show, every time we talk about case numbers, it is not just because we're testing more people. You can see here the positivity rate is rising even as we test more. If there's not an explosion cases as you test more, the positivity rate should be going down, or at the very least keeping steady. It should not be rising. And it's rising far more in some regions, implying that this is an increase in numbers of infections, not just those being diagnosed.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.